There was a request to talk about or to discuss what after, what is life like after I go through the knife or whatever. So maybe Dr. Speca will tell us a little bit about this. Credentials, well, you are an adjunct professor in psychosocial oncology at the Department of Oncology, Faculty of Medicine, University of Calgary. That's a long handle. That's what it is. It is what it is. And you're also a clinical psychologist at the Tom Baker Center. You've been in this trade with your groups, your support groups, since 1993, I think it is, or perhaps even earlier. Yeah. So he's got two very popular groups. One is the mindfulness-based stress reduction program, and a best supportive expressive therapy group for women with metastatic breast cancer. I don't know, is this the first time you've spoken to a prostate cancer group?
Yes, exclusively, although one of our early studies was half prostate and half breast cancer.
Okay, and we may hear a little bit more about that. He's a co-author of a book that I was encouraged to buy when Steve Bellway and I met Mike, and so his book is now in our library and available for you folks to borrow out, loan out, sign out, whatever the word is. Here's a mentor of Dr. Speca, and that name is something, Jean Kabat-Zinn. Close enough? If you give yourself over wholeheartedly to what is being offered in this book, it could make an enormous difference in your life and health in important ways, too numerous to count. The authors are committed practitioners of mindfulness and their mindfulness-based cancer recovery program. They're firmly rooted in research findings, and it radiates an authenticity that you can readily feel, and that will grow with time. Dr. Speca, the floor is yours.
So that was very kind of Dr. Kabat-Zinn to commend our book. He's a wonderful teacher and very famous for this concept of mindfulness. He published a book called Full Catastrophe Living, and I don't think I talked you into buying the book, but I did suggest it could be useful to your members. I'm always very reticent to commend my book when Dr. Kabat-Zinn wrote such an excellent book many years before ours, and the difference is that ours is focused on cancer, whereas his is more broadly focused on living with all kinds of stressful situations. So tonight I want to talk a little bit about mindfulness with you. I want to tell you about our program. I want to tell you a little bit about the research that we've done, try to encourage you to understand what mindfulness is, although it's very hard to fully understand it without practicing it. But we'll do a little practice too, if you're willing. And some ideas about how you can make it useful to yourselves, and maybe how to get going if you want to develop a mindfulness practice. So I'm appreciative of you coming out. Yes, the cold weather, and also Westminster Dog Show is on TV tonight. But my wife is taping it for me, so I'll watch it later. So a little humor. I'll read the panels of the cartoon to you. Hi, we're here for the Happiness Through Meditation seminar. And they walk down and they see, oh, that was a typo. It's actually happiness through medication. And the girl says to her friend, I told you we should have gone to the movies instead of pursuing happiness. So I think one of the exciting things about this whole mindfulness business is it's something that you can do for yourself. You know, it's something you can take some control over. One of the aspects of having illness that's so difficult is you're reliant on so many experts and other people to help you and to support you and tell you what you need to do. And this is something that every person can do for themselves with a little bit of application of intention and practice. So this is something that, an area of your life that you can have control over. So some 20-some years ago, I was a therapist at the Cancer Center. I never intended to go into cancer as my area of work, and happenstance had it. There was a postdoctoral fellowship there, and I got involved through some odd circumstances, but I ended up being hired there. And so I was counseling patients to deal with many kinds of issues I'm sure you're more than familiar with. So these are common experiences of many patients. The whole threat to your life, the sense of mortality, the possibility of dying from your disease, which always comes into people's minds, even if it's not highly likely. The sense of loss of control, which I've mentioned already. The loss of certainty. You think you have your life planned and you know what you're going to be doing next year, and suddenly everything is thrown up for grabs. And the emotional consequences and the symptoms, side effects of treatment and so on. And lastly, the fear of recurrence. Now, it's so common for many of our patients. So I was working, doing traditional counseling around all of these issues with our patients. And one day, sitting at lunch with two of my colleagues, we were talking about our work and the stress it placed on us. It can be stressful. You get to know people pretty well. So in a way, you suffer with them through that. And over many years of working with people, it can be quite challenging. But we all discovered that all three of us had our own meditation and or yoga practices. And we wondered why we weren't teaching anybody to do those things, because that's what we did to cope. So we said, okay, let's do that. We developed a program and based on our own experiences. We ran a small clinical trial by a man who started his own foundation called the Alternative Cancer Research Foundation. His name is escaping me at the moment, but he's a Calgarian, and he gave us a grant of like $2,000 or $3,000, as I recall, to run a clinical trial. So we cobbled together a little clinical trial with a waitlist control condition. And we found amazing benefits to the program, especially in the realm of the emotional benefits of being in the treatment. People who took the meditation program had much less negative emotionality, greater sense of energy, and positive emotions, better quality of life. So we thought we were onto something. So that was in 1996. A year or two later, Linda Carlson came to us from McGill, yes, right, McGill University. And she's a really keen researcher. She became principal investigator on some subsequent research programs. And so we upped our game with regard to the rigor and the questions we were posing in our research. So we started that program, and then we started asking people, you know, what in the program did you think was valuable? What did you benefit from the most? At that time, there was a meditation component, a yoga component, and some yogic breathing, sometimes called pranayama, different breathing techniques to alter the mental, emotional, energy state of the body. And it was funny because about a third of the people thought one of those aspects of the program was the most important. So we ended up keeping them all. Linda and I then went to do a week-long retreat with Dr. Kabat-Zinn. About that time, there was a program called Healing in the Mind on PBS. You may have seen that, where Bill Moyers went around the country and interviewed people doing kind of cutting-edge alternative and complementary medicine research and programs. And he featured Dr. Kabat-Zinn at that time. And I hadn't known about him before that. So Linda and I went and did a week with him, and we slightly modified our program to correspond. We thought, why reinvent the egg? Is that the saying? What's the saying? The wheel. So we modified the program just a little bit. It's open to cancer patients and their family members. We've had over 2,000 Calgarians over the years. And so we do ongoing programs, usually at least 2 a year in the fall and in the winter, spring, sometimes 3. And we marry it to research studies as we go. Just so you get a better idea of what the program is like, it's 8 weeks long and we meet for an hour and a half weekly. There's a bit of discussion or teaching in the beginning. Then we do some it's really gentle yoga. We think of it more as mindful movement. So you don't have to have a lot of physical capacity to do these things. It's just exploring what you can do, learning to relate to the body in a constructive way that kind of reestablishes a sense of trust after you've gone through an illness. And also teaches us to be sensitive to what's going on in the body generally, not just in a disease-focused way. And the meditation itself, which is in our program is a form of meditation known as mindfulness. It's similar to what some people know as vipassana or insight meditation. But it's a kind of meditation that's kind of transcends various traditions of meditation. Similar forms of meditation are done within different religious faiths as well as in various schools of Buddhism. And during that 8 weeks, and hopefully thereafter, we encourage people to practice every day for at least a short period of time. And there are many research studies. We published the first one, I think it was in 2000, but since that time there have been dozens of others, and these are some of the findings. I don't want to, this group I don't think is keen to look at lots of graphs and charts of outcome measures, but these are the general ways of describing some of the findings. Improved overall quality of life, increases in the sensitivity to spiritual issues and an involvement in one's own spirituality, however you define that. Increases in post-traumatic growth. You may be familiar with that construct or that variable. Post-traumatic growth is this idea that sometimes after a traumatic experience like having cancer, it opens up new vistas in one's life that are often very advantageous, and we can measure that. People tend to sleep better. There's improvement in cortisol rhythms, and I'm going to talk a little bit more, explain what that is. Less inflammation in the body, which is something that can be helpful for many kinds of illness to reduce inflammation. Improved mood, more energy, less rumination, worry, and depression. Less experiential avoidance. I'll tell you more about that. And by the way, I'm happy to answer questions. I think Stuart would suggest we should probably wait to the end, but I'm okay with just speak up and we can address your questions as they arise. Decreases in stress and decrease in systolic blood pressure. Now I mentioned this cortisol issue. Now some people may be familiar with this, but we do have this hormone cortisol that's involved in the diurnal regulation of our physiology. So there's this normal pattern that we see. It's the middle one on this graph, where in the morning cortisol levels are very high and they decrease throughout the day. They're lowest in the evening when we're sleeping, and then they rise again towards morning. That's kind of normal for a healthy person. What we see with various kinds of illness populations is a flattening. So whether it starts low and stays low, or starts high and stays high, there's no slope in that curve, and so those are considered abnormal. We found that participation in this program helped to re-regulate and establish a more normal curve of cortisol, which you could take that as a kind of a proxy for how well the body is self-regulating and following normal physiological patterns. This is the cover of the book that Linda and I eventually wrote, trying to, there's only 2 of us, and we want everyone everywhere to be able to have access to this material. So we wrote this book, and it's available in public libraries. And Stuart has graciously purchased a copy for your library as well. The Cancer Center has some as well. So now, I've already told you some of the outcomes about mindfulness practice, but I want to try to see if we can establish some working definitions here that will help you understand mindfulness. First of all, I just came back from Palm Springs, and I have a friend down there, and a lot of people down there golf. Any golfers here? Can I see hands? Any? So, how many meditators here? A lot more golfers than meditators. Well, meditation's supposed to be good for your golf too. So maybe that will encourage you, if nothing else will.
How's your golf game?
My golf game, it's improving. This season's going to be the best ever.
Yeah, there you go.
So, I'm going to share some definitions or descriptions of mindfulness that have been used to help develop a concept for us here. Intentional, non-judgmental awareness of what is actually happening in each moment within us and around us. So that's similar to Jon Kabat-Zinn's definition. So we look at the intentional. So I'm paying attention on purpose. We're always kind of paying attention to something, but it's usually what directs our attention. Could be anything. You know, we flit from one thing to another, but here we're going to say, no, we're intentionally paying attention to something. And it's kind of non-judgmental. We just want to see what's there. We don't want to, you know, we're trained a lot in our academic system to be very critical and analytic. We want to push that back a little bit so we can perceive a bit more freshly and in a less biased way before. We don't want to prejudge our experience. So we want to see it, the plain facts. What was that, what they used to say in Dragnet? Just the facts, ma'am? We just want to see what's really happening. And how do we tell what's happening? Through our senses. Through our sense gates, it's sometimes called. Through the sense of touch, hearing, sight, sound. I said hearing. What did I leave out? Smell. And the mind itself is also sometimes considered a register of sensory experience, which is a kind of our inner mental experience. It registers in our minds. So that's how we become aware of what's going on right now. I'm aware of the pain in my right shoulder that if this is anything less than the most stellar golf season I'm ever going to have, it's probably because of that pain I feel in my right shoulder right now. So that's the intentional paying attention to what is actually happening that we perceive through our senses and the attitude, the non-judgmental. What is just happening? A traditional teacher, Thich Nhat Hanh, he's a Zen and also a Theravadan monk, who's famous for writing about mindfulness in a very direct and simple, accessible way. He says mindfulness is the miracle which can call back in a flash our dispersed mind and restore it to a wholeness so that we can live each minute of life. If you think about our consciousness throughout the day, where is it usually? What's going on? Just think about that for yourself. What's going on in the mind that, you know, becomes the focus of our lives throughout the day? It's all kinds of stuff, right? I've done all kinds of work in my life. A lot of jobs I've had. I worked construction for a while. Everybody always wanted to have the radio on all day. So my mind often had repetitive lyrics of rock and roll music bouncing around in it. What about your mind? What's going on in there? So whatever's in our mind tends to become our experience. We identify very much with whatever's going on in there. So with mindfulness, we're going to be kind of withdrawing from all that busyness of the mind, the kind of, some people call it monkey mind, this kind of associative, jumping from one idea to another, one thought to another. Some people call it like robot mind. You know, whatever's in our mind, Calgary traffic, then we get all worked up about that and start making decisions about, you know, what we would do about it if we were mayor of Calgary, or how we would get better snow removal. So there, I'm showing you how the associative mind works. It just goes from one thing to another. So we can live our life like that. Is that really the best use of our consciousness? So how do we not do that? How do we not have that monkey mind? It's not easy. It can become like a habit. Some other descriptions. First one's just very similar. I think we already did that, didn't we? What does it mean to be mindful? This is another Buddhist monk. It means to be fully aware right here, concentrating on what is going on inside. Mindfulness is not necessarily concentrating on an object. So some people are aware that meditation can be done by staring at an image or a candle or something like that. This is not what this is. Those are forms of concentrative meditation. Mindfulness has some components of that, but that's not what it is. Being aware of confusion is also being mindful. We're confused sometimes, and we could be kind of overwhelmed or living in that confusion, but if some part of our mind is able to maintain a bit of perspective and say, oh, I see that confusion. It gives us leverage, a little bit of distance from it, so we can then make choices about it instead of being fully identified with that confusion. If we have all kinds of things coming at our senses, noises, people demanding this and that, we cannot concentrate on any one of them for very long, but we can be aware of the confusion or the excitement or the impingement. We can be also aware of the reactions in our own minds. This is what we call being mindful. So that's very important. We're aware of what's happening and also our own inner reactions to what's happening. Because that space is where we have some possibility of choice. First of all, discernment, what's going on. Second of all, enough awareness to step back and say, what is the appropriate, wise response to this situation? Less reactive, less habitual responding to situations. This is what we call being mindful. I think I just came up with these as elaborations. It could be thought of as an inner technology or a method of acquiring knowledge by paying attention. You know, we're equipped to learn by just paying attention. If we pay attention, we'll learn something. Let's use that to its fullest advantage. You know, there's a lot of poles competing for our attention. And some people are very expert at it, right? Any marketers in the crowd? So people that study how to gain your attention and direct your behavior in certain ways by manipulating your emotions. Why don't we become experts in our own mental apparatus and how our minds work? That's what this is. Mindfulness is a component of an innate system of biofeedback and self-regulation that's conducive to inner peace and well-being. And when mindfulness meditation and mindfulness in daily life are combined with what I'm calling mind training, it can be used to develop salutary or beneficial emotional and mental factors such as equanimity, the ability to stay calm in the midst of very trying circumstances, equanimity, generosity, morality, patience, loving kindness, compassion, wisdom. And in developing these mental factors, our conduct can then be guided by these, what are sometimes called perfections of the heart, or in our culture we often refer to these as virtues. How do we live a virtuous life? Well, having mastery of our mental apparatus is an important part of that. Understanding how that works. So there's mindfulness, which could be happening anytime, like right now. If I were to say, what are you mindful of right now? You could respond. You could say, oh, here's what's in my mind. Here's what I'm aware of. That would be a form of mindfulness at a pretty basic level. Mindfulness meditation, however, is a formal practice where you say, okay, I'm going to be mindful, as fully mindful as possible of what's going on. And we train our mind to stay focused in this way instead of being scattered, instead of wandering off on all kinds of journeys, to make it available to what's going on right now in this moment. This also will allow us to recognize our mind as it goes off on all these tangents. The constant stream of conscious and sometimes unconscious or subconscious thoughts, feelings, and habits. Habits. You know, you could think of stress, you could think of maladaptive coping, kind of fancy words. You could just think of them as habits, ways of life that we've gotten to, we execute in a routine way or a habitual way that may not serve us in the best possible way. I think it's obvious what some of those are, but almost any habit taken to an extreme can be detrimental. So I want to just bring you through a very brief actual mindfulness practice if you're willing. So I have this lovely mountain photograph here to help suggest the calmness and clarity that sometimes is used as a metaphor for the mind once you see past all that busyness. You know, the mind is often a metaphor often used as the mind is like the vastness of the sky, infinitely broad and open, whereas the thought, the content of the mind is often like the stormy clouds. If we can see past the clouds, we gain access to this immense capacity of awareness, and that space is capable of holding everything, holding our whole lives, holding our whole history, holding our whole future. Everything is held clearly in the midst of that clear sky, and our mind is like that. Infinite capacity. So sometimes, you know, we feel our mind is overwhelmed by so much busyness, but that's partly because we're right in the middle of it with our sense of ourself. We identify so much with it. If we can use mindfulness to say, okay, I step back from all that busyness and I can see it more clearly. I can see it as it's unfolding. So it can also be cultivated as a way, like a way of life. An inner discipline for learning to meet and enter with awareness the challenges inherent in taking care of ourselves and serving others. So that last is a quote by Saki Santarelli, who's the current director of the mindfulness program at the University of Massachusetts, where this work began with Jon Kabat-Zinn many years ago. I was ahead of myself a little bit. So mindfulness supports good coping versus the alternatives. I know you've heard a lot about coping if you're part of a support group, right? So good coping, characteristics of good coping is, one is that problems are, you know, problems seem, that's a pretty kind of a negative connotation to problems. So sometimes just shifting that a little bit to challenges is helpful. It seems less daunting if it's a challenge. It calls us to it instead of making us want to shy away from it so much. Good coping is proactive. And these challenges are seen as opportunities. And in this mindfulness perspective, the opportunity is to learn something about how to deal with difficulty, learn something about ourselves and our own reactions to our lives, and how to be at our best under difficult circumstances. So every challenge gives us that opportunity. And that's a more supportive way to think about problems, you know, that we can engage with them and we have what it takes to find solutions. If you have that mindset, you're much more likely to be able to do it. They're practical, they're relevant to the context. So it's not like a magical thing, it's very down to earth. They're flexible. And the last thing, resilient. There's more where that came from. I'll get through this day, I'll get through this challenge, and I'll actually get better at solving problems and dealing with challenges. So the next time one comes up, I'll have more skills. So stress reduction 101. Life is challenging. In case you didn't know. But in mindfulness, we like to think about also, though, the suffering, which is sometimes called the second arrow. So the thing that happens to our life that we didn't ask for, told you had a cancer diagnosis. Challenge. But suffering, a lot of the suffering then is a it's partly our creation, what we bring to it in terms of our sense of what it means for our life, our interpretation of what it means. And so this stress reduction really focuses on this part, because that's the part we have some ability to work with, our own way of looking at the challenge. There's a lot of potential to work with that and not create more stress, more challenge, more suffering than necessary. A lot of these sufferings relate to perceived threats to our sense of self and ego-based strivings. You know, we work very hard to develop our sense of ourselves as adult human beings, and we cling very preciously to that. We created it throughout our life, and sometimes we can become so focused on that and so self-centered we miss a lot. And so this is asking us to take a step away from that and to look at other perspectives. I'll say more about that. So I just became mindful that I forgot to do something that I told you I was going to do. And some of you are nodding your head yes. So what is that? I was going to lead you through a brief mindfulness exercise, so I'm going to do that right now. See how this mindfulness works? I became aware of that, and I can now respond to it. I didn't do that on purpose. So this is very simple. It's not religion, it's not mumbo jumbo. It's paying attention. So let's pay attention. But I'm going to ask you to direct your attention in certain ways. Let's start by what I'd like you to do, if you're willing to, you don't have to, but maybe close your eyes. And one of the reasons I want to is because I want to start with perception of feelings in your body. So sometimes it helps to kind of close off some of the sensory channels. It makes it a little easier to focus on some of the others. So sensory channel of the body. So we can feel, like touch is one of them, right? So where you're sitting on the chair, there's a lot of pressure, so you can feel that, right? You can feel the sense of the pressure on your skin and the muscles, the sensible tissues that are against the chair. You're aware of that. Now there are more subtle body sensations you could be aware of too. You could become aware of the feeling of your fingers if I asked you to, and I will ask you to do that right now. Become aware of the feeling of your fingers and your hands. You know, the inner palm, the sensitive parts of the fingers and the back of the hand, the nail beds. You're aware of that without looking at it. You can sense where the nails are. You could bring your awareness to the wrist, the forearm, the upper arm, the shoulders, the neck. So I've just mentioned the neck and shoulders, and sometimes that's a place where we hold a lot of tension. So using that awareness, if right now in your shoulders and neck you can feel a lot of tension, perhaps you have some way where you could just give yourself permission to soften that tension. Let your arms hang floppily from your sockets, just like a Raggedy Ann doll. Let your jaw be soft, so your lower jaw just hangs from the sinews. Let your tongue be soft in your mouth. Become aware of your face. Are you holding any tension there? And if so, could you let it go? Bring the awareness further down the body, maybe to the chest, the belly, the area of the pelvis where the genitals are. And this is an area that we hold tight when we're nervous or tense because it's very vulnerable, right? So if you're holding tension there, could you soften that? So I'm leading you through the awareness and then giving you the choice to, if you'd like to, you can see if you can encourage letting go, relaxation of the muscles. The large muscles of the legs and buttocks, all the way down to the feet, the toes, the soles of the feet. And if I asked you to, you could probably be aware of the sense of the body as a whole. All connected, all working together, where there's so much wisdom and, intelligence going on that maintains your life moment by moment. So much going on outside of our awareness. So much innate wisdom and intelligence that keeps us going moment to moment. But we can feel something of that, right? We can feel the sense of presence of the body. Maybe the flow of breath, the beating of the heart, the arterial pulse, the strength of the body, the energy of the body. Depending on how sensitive and how much you pay attention to what's going on. And then lastly, maybe I could ask you to become aware of, maybe not lastly, how about the mind, the mental part of the let's say the thinking part of the mind. You can probably recognize, you're listening, you're hearing what I'm saying, and then there's usually some sort of digestion of that, some kind of analysis, and maybe acceptance or rejection of it, or thinking about it. You might also have emotional responses going on in your body. They could be very subtle, or it could be a strong emotion that you can easily identify, give a name to. There's a difference though, the feeling itself and then the name we give to it. So you could be aware of the feeling itself, and maybe or maybe not you'll find a label up there in the thinking part of the mind. Let me ask you now to bring awareness to, focus your attention on the sensation of your own breath. Find some place in your body where you can feel a sensation that represents the movement of breath in and out of your body. So, traditionally the tip of the nose or the sinuses, or the belly rising and falling, the abdomen rising and falling. So not the idea of the breath, but the actual palpable sensation. Can you find that? So bringing attention there. So when breath is moving in, you're aware of the sensation of the breath moving in, breath turning around, breath moving out, breath turning around again and coming in again. Just your normal, natural breath, no fancy schmancy breathing techniques. Just allowing your body to determine how much breath it wants or needs in any given moment. And just attending to that sensation, 1 second, 1 moment by moment. Breath by breath. And even as you do that, as you follow my instruction, you'll probably find that there are distractions, right? Ideas flash through the mind that for a moment at least take your attention off that sensation. But you could bring it back. So what I want to do now is I'm going to ring these symbols, and I'm going to ask you to just follow the breath for about, just a few seconds, maybe less than a minute. But what you'll notice probably is that your mind will start to do other things despite your best intention to pay attention. And what I'd like you to do is, once you notice that you've gone off somewhere else, that's okay. Just let go of wherever you went, and for the next moment or two, come back to the next breath. So start over again however many times is necessary. So I'll ring the bells 3 times, and then I'll ring them one more time in about a minute. In the meantime, just pay attention to the sensation of your own breath. So go ahead and open your eyes if you've closed them. And did you notice your mind going off at all? Any times? Mine only went off 20 or 30 times during that minute. I thought about how long should I do this? There are people on a camera somewhere else. I don't know if they'll want to sit there silently for a minute or two. And oh, what am I going to say next? So, you know, that voice, we all can recognize it, right? Sometimes we don't recognize, though, how central it is to creating our sense of stress in our lives. That voice that registers the future problems, and we start to carry them now instead of when they're actually here. All the problems from the past, all the regrets that we can bring back into the present, all that all at once, it can be a lot. But if we can let that go for a minute, I think we recognize that this moment's not so bad. We can probably deal with this moment. And what is our life but one moment following upon another moment? And you know, you've got this far, you'll probably get quite a bit further. And the mindfulness, then, as we develop it as a basic way of being in our world, in our lives, we can start to notice more what we're doing with ourselves and with our minds during the day. Are we really investing that brilliant consciousness on the things that make the most difference to us? Or is it, you know, really mundane things? The me train. I call it the me train here. This idea that we have to be certain kinds of people and we have to have certain kinds of things to be okay. All that stuff we accumulate around us that gives us our sense of our identity. You know, that can be very burdensome as well. So we can use this mindfulness also to notice when we're not exhibiting these virtuous qualities that we all would aspire to, right? We want to be the best we can. We want to provide service to others, be helpful and good. But sometimes we don't. We're not that. And so mindfulness allows us to notice when we're going down the wrong path and to say, wait a minute, that's not what I want in my life. Without mindfulness, though, we could be all the way down the road before we know it. Lost. So we can use this mindfulness to say, wait a minute, I don't want to be in an angry state right now. I don't want to be in a stress state right now. What can I do to shift gears? So these are some attitudes we talk about in the mindfulness program. Non-judging, patience, beginner's mind, trust, non-striving, acceptance, and letting go. Now, whenever we talk about this in the program, people all say, oh, you know, these are things that we don't generally get much support for in our culture, right? We're supposed to be real critical, judging people. We're supposed to get things done. We're supposed to know a lot. But if you want stress in your life, just turn these around. Become judgmental, impatient, know-it-all, paranoid or distrustful, striving, rejecting, and grasping. Just think about those words and what it's like to live a life characterized by those qualities. It's a pretty tough way to go with this one.
What do you mean by beginner's mind?
Okay, beginner's mind is the idea of trying to be aware of our pre-existing prejudices and see things more freshly. So there's an old story that's often told about the academic who goes to see a Zen master. This is a classic story, so I'll share it with you. And the academic comes to meet the Zen master, and the Zen master starts pouring tea in the formal, ritualized way that is done. And the academic can't stop talking about what he knows about Zen and about Buddhism. And so the Zen master's pouring the tea, and the cup overflows, and pretty soon the academic says, "Stop, you idiot, can't you see? The cup is overflowing." And so the moral of the story, well, you're so full of it, your own ideas, how am I going to teach you anything? And we're like that too. You know, men especially, I think, are encouraged. You have to know everything. You have to be an expert on everything. It's kind of like a proxy measure of how good we are as human beings. But the problem with knowing it all is you're not open to anything new learning. And so beginner's mind is a way of trying to see things freshly. You know how a child is on the playground? They're amazed by the simplest thing. We can rediscover that, sometimes by paying attention, because often what happens is maybe we're in the presence of something amazing and beautiful, like all you people here. But if I have you put into just some category, prostate cancer patients, what do I see? I'm missing so much. And so this beginner's mind is trying to strip away all the preconceptions. And as much as possible, we can't do it absolutely, right? But at least we can do is start to be more aware of our labeling process and how that shapes what we see. Because once we think we know it all, we're missing so much. Instead of seeing clearly, we're imposing our ideas on what's actually happening. So we could go on with each of these and discuss each of them. I won't do that here and now because it will take quite a while, but they are discussed in all the books on mindfulness. So we encourage people to try this out. Catch yourself when you're being judgmental. About other people. It's so easy to find people lacking, right? We have ideas about how people should be. And pretty soon we label them and we don't see them as full, complete human beings anymore. We don't want to let that short-circuit our possibilities for discovering things about people that might be very valuable to us. Patience. Things take time to unfold. A lot of things that are worthwhile, they're not instantaneous. Right? Everyone knows that. Mature people know that. There was a famous study that was done, I think, in Brazil and then replicated at Stanford, where they gave children a piece of candy and said, if you don't eat this candy in the next, I think it was 15 minutes, I'll come back and give you another piece. And so the camera watched the children, like some of them were salivating and you could see them fighting not to grab the candy. And they followed up on the children many years later, and those children that were able to exhibit that restraint were much more successful in all the conventional ways of measuring that later on. So that the ability to recognize the impulse but not act upon it is a sign of maturity. Okay, so I will be tempted to go through all of these, but I'm going to leave that for now. So we ask people to try on these attitudes. Again, you might not get, I don't know, maybe you will, but if you read the How to Get Ahead in Corporate World, they probably won't tell you these things. But if you want to get ahead in inner peace, if you want to get ahead in relating to other human beings in a caring, compassionate way, these things might prove useful to you. Another thing about this mindfulness and also mind training is the idea of turning towards rather than away from what is difficult. So often we want to avoid what's difficult. What happens though? That deprives us of the opportunity for certain learning to occur. So this is a Tibetan prayer. I take it on the word of Jack Kornfield, who wrote a book called A Path with Heart, which is about loving kindness practice. Grant that I may be given appropriate difficulties and sufferings on this journey so that my heart can be truly awakened and my practice of liberation and universal compassion may be truly fulfilled. Grant me appropriate difficulties. So recognition that difficulties in life can be a kind of a leavening factor that develops our most important qualities, the ability to be empathic, to understand suffering, to display compassion and caring for others. These things happen more easily for those that have experienced suffering themselves and understand what it means. So we don't want to run away from those experiences. Here, from closer to home, the epitaph of Robert Kennedy after Aeschylus, Greek, I think he was a philosopher. In our sleep, pain, which cannot forget, falls drop by drop upon the heart until, in our own despair, against our will, comes wisdom through the awful grace of God. So we're encouraged not to just pursue after the things we think are delightful and tasty, but also to encompass the whole of our lives, which includes, inevitably, illness, suffering, loss, and death. Here from a Christian mystic, contemplative, Thomas Merton. The whole idea of compassion is based on a keen awareness of the interdependence of all these living beings, which are all part of one another and all involved in one another. So again, this relates to that getting out of our own little bubble of our own little heads sometimes and recognizing the interdependence of all of us. None of us are autonomous, ultimately. Here, again, a Western scientist. Some of you may be familiar with this quotation from Albert Einstein. A human being is part of a whole called by us universe, a part limited in time and space. This is before women's liberation. He experiences himself, his thoughts and feelings as something separated from the rest, a kind of optical delusion of his consciousness. This delusion is a kind of prison, restricting us to our personal desires and to affection for a few persons nearest to us. Our task must be to free ourselves from this prison by widening our circle of compassion to embrace all living creatures and the whole of nature in its beauty. So this is related to this idea of transcendence a little bit. Transcendence of our own miserable self-concept and the limitations that we impose on ourselves, to see more broadly, more wisely, more integratively the true nature of our lives. And so I'm going to pause now and invite questions if you have any. I don't know how long we were supposed to go, Stuart, but questions. But do you feel you have a basic sense of what this mindfulness is about? It's about a lot more than that. This is like basic mindfulness.
Describe your 8-week course.
Okay, the 8-week course involves mostly it's learning the applications of mindfulness to stress and stress reduction. So this idea of events happen in our life, how does it turn into stress in our body? It's not a given. We know that a certain event could be very stressful to another person and stressful in a negative way, corrosive way, whereas another person it would mean nothing to. What's the difference? We're basically physiologically almost the same, right? It's what's happening up here. Happiness is a inside job, I guess some people say, and same with stress. Stress is an inside job. It's how we interpret the experience that creates the degree of stress we experience. When we perceive a threat, and it could be a very real threat like an illness or a sea train bearing down on us because the bar didn't go down in time. So some threats don't take a lot of interpretation, but most of the things that really get to us, our day-to-day lives, the stress of our day-to-day living, most of it's really up here. It's not the actual event, it's how we interpret it. So a lot of the mindfulness as it relates to stress has us be aware of how we're transducing that experience into the stress in our own bodies, how we're activating that fight or flight response. Everybody hear about that, the fight or flight stress response, triggered by the hypothalamus pituitary adrenal axis in the center of our brains, turns on all the stress hormones, makes us strong, lets grandmothers pick up trucks that are on babies and stuff like that. Those kind of stories make the newspaper. That's the fight or flight response. It's a charged state of being, but it can become almost a way of living if we're very stressed. And our bodies aren't made for that, always living in high gear like that. So that 8-week course is learning how to recognize those factors and modulate them so that we don't live in a stressful world all the time, because a lot of it's up to us. I got a cough, just a sec. So each class begins with some teaching. It could be those attitudes we talked about, or it could be about neurobiology, how experience changes our brains. Did you know that? When I was a kid, they said your brain stopped at a certain age and it never changed, and now we know it's not true. The way we use our brains actually changes the connections in our brain, and especially in that HPA part of the brain that's like the main circuit board. We can establish new connections. So for people that have a long-term problem with depression or worry or anxiety, it kind of becomes almost hardwired. It's not quite, but it's modifiable through experience. So if we can learn to notice the triggers, notice our initial impulse towards our habitual reaction, but say, wait a minute, take a step back, take a breath, we have the ability to calm ourselves if we have the skills. It's not that hard. That part's easy. We can teach a person to stimulate the parasympathetic nervous system, which is that, have you ever been on a vacation somewhere that was, everything was perfect, perfect weather, you felt that you left your troubles behind, and it feels so different in the body, right? But that's always with us. We just have to know how to press the right buttons. And they're all up here. So we learn how to do that in that 8-week course. And then we encourage people to develop practice so that it's not only during the course. The whole idea is you take this learning and you apply it to your every experience every day as much as possible. I forget who the author is at this moment. Wrote the book called After the Ecstasy, the Laundry. I'm not sure if it was Jack Kornfield, maybe. After the Ecstasy, the Laundry. So, you have to wash the dishes, right? Washing dishes, that's part of life. We got to do it. So what's your attitude towards washing dishes? I got to go wash the dishes. I'm sick of washing dishes. I've washed dishes my whole life. How is that going to... Okay, maybe you bought a dishwasher. But what, then you got to... I know, they got robots that sweep the floor. Everything's taken care of. But no, there's always something that's part of maintaining our lives, maintaining our households, maintaining our relationships. It can seem like work. So what about taking the attitude of this could be a delightful experience? Hey, the warm water on my hands actually feels pretty good. It's interesting how, I rub the thing with the sponge a few times and now it starts to feel smooth and it's clean and shiny and now it's beautiful. You can have a different attitude towards ordinary experiences and your whole experience of your life can change that way. And I've not talked about relationships, which is probably the most important thing for human beings. If we can step out of our own self-centeredness and relate to other people in a more open way, fuller way, a more honest way, if we can empathize with their experience, it forms much stronger connections, deeper connections. So there are many infinite applications of mindfulness. In the program, we teach you the basic skills, and we encourage you to incorporate it into your life forevermore. Does that answer your question? Okay. Okay. Others? Yes?
Bob and I have been through your course in 06 when we had both finished treatments with cancer, found it very helpful.
Okay, good. So your subjective experience of the program, it was very helpful. Good, because that means our research didn't miss that. Our research corresponds to what people tell us. Generally, this is the case. Now, it's not always easy. Sometimes what happens in the beginning, it actually gets harder. Because what happens when... I talked about unhelpful coping techniques like avoidance, right? Do anything else but face what I have to face. Unhelpful coping techniques. So, however, when we stop doing all those things, blunting our sensibilities by drugs or alcohol or addictions of various kinds, when we stop doing that, suddenly we can become much more aware of some of the unsatisfactory aspects of our current way of conducting ourselves, and that can be very difficult. And so that's partly why what's called a loving kindness practice is taught early on. In loving kindness practice, we get in touch with our capacity for feeling benevolent feelings, like love. And we practice feeling those things and directing them towards ourselves and others. So in Calgary and other places where there's a lot of Scotsmen and other Northern Europeans, it seems like you're not allowed to like yourself. We're so self-critical. It's really hard to say, it's okay to treat yourself well and to be kind to yourself. You know, we're very judgmental, not only of others, but of ourselves, and so harsh on ourselves, punitive. And that can be very limiting for us if we only see our faults and not our possibilities. And so we want to accept that, yes, we're flawed, but we have good qualities, and we should direct care and love towards ourselves as well as towards others. And they really go together. You can't do one without the other. You can't be very much benefit to someone else if you are depleted, if you are not well yourself. So being kind to yourself as well as being kind and caring towards others is part of this practice. To overcome especially that first discovery that, gee, I am a schlemiel. Yes?
When a negative thought or bad stress starts to come into your mind, I think what you're telling us tonight is that you hear a lot of people say, well, don't think that, block it out. But I don't know if the mind works that way. So I think your skill is, or your program is to, when you feel that coming in, kind of stop and start to actually feel your toes and work up to your kneecaps.
Okay, so I'll repeat the question as I'm understanding it. So when bad thoughts come into your mind, what do? The common recommendation to blank out your mind or don't think those thoughts, that's usually doesn't work. And some of you said you were golfers, so you know when you say, don't look at that lake over there, where's your golf ball going to go? Yes, so part of the skill is first noticing that we're going down that track in our own minds. We can notice the negative or worrisome or depressive thoughts or anxious thoughts. We notice them, and then what can we do? Well, partly just recognizing that they are just thoughts is helpful. It gains a little distance, so that's reducing the amount of identification with the thoughts. We can learn to say, you know, we can watch it like almost like a movie show or like a dream. Those are just thoughts. We don't have to buy into them so much. But then we can, as your question suggested, we can choose what to think instead. So we can't say don't think or just blank the mind out. It's not that easy, but we can say, instead of thinking here about, let's take a negative thought. That guy is cutting me off in traffic. He's a SOB and totally uncaring individual. Something along those lines. You could think that, but what else could you think that would end up with you feeling something different, perhaps more beneficial? What could you say? I heard something.
Run into him.
You could, you could run into him, or.
I got through that a month ago.
Well, I know as an expert I'm not supposed to offer advice, but I'd say don't run into him. Don't pull out your gun or whatever. No, you could say something along the lines of, oh, there goes a person kind of like me. They're kind of in a hurry. They're kind of maybe got other things on their mind than good driving. Have you ever made a mistake driving yourself? Never, never, right? So, you know, if you take an approach such as that, direct your mind to see the situation in a broader context, you might not have as angry and of a response. So that's kind of the idea. And we might even say, man, that guy must be under a lot of stress. He's driving through the world not knowing what he's doing. Pretty sorry state to be in. So if we think that, we might be a little bit more kind and understanding of what they're going through. We've been there too. I admit it, I've probably cut somebody off in traffic. I know I have.
That's why golf is good for you. It relaxes your mind.
Oh, yeah.
Yes, and as we practice these methods, I mentioned that mental activity can be like habit forming. We kind of reinforce those tracks in our mind or in our brain. They're not the same, but they're related. And those ones we use a lot start to be reinforced. And so you can find yourself being angry all the time. But if we can change that, we can shift it, we can start to use more considered responding to situations. We can start to develop alternative behaviors, alternative ways of thinking and feeling in relation to these experiences. And then we're less bothered often by these troublesome thoughts. So Dr. Zindel Siegel in Toronto found for people that were depressed and had a habit of ruminative worrying as part of their presentation, we're able to reduce that through these mindfulness practices. Less worrying. So it is possible. It looks like Stuart's telling us our time is about up. I am available through Alberta Health Services. Please contact me if you'd like to learn more. If you want to visit with me, I'm happy to do that. So thank you very much. Stay around here.
It seems to me that there's maybe a parting message. I don't know how many of you have difficulty having a continuous sleep over the evening. I'm up at least 2 or 3 times a night. How about the balance of you? Any of you ever have to get up at night? There you go. What's your parting thought on that you leave with us to help us?
Well, you know, mindfulness practice has been shown to help with quality of sleep. It is not the most effective treatment for pervasive sleep difficulties. Cognitive behavioral therapy for insomnia is the most effective treatment for insomnia, but mindfulness added to that is often, it looks like in at least a couple of recent studies, to add to the effect of cognitive behavioral treatment. But the thing about sleep is, you know, again, what's the mental activity? Oh, I have to get up again. Even if it's related to frequent urination. Oh, reminds you of your cancer maybe, right? And then what's going on in the mind? And then you get back in bed and what's going on? The mind is racing, and that's not conducive to sleep. So we can learn how to bypass that habitual struggle. Sleep is not something you can make happen either. It's something you have to allow to happen. And we can create conditions that make it more possible, including reducing the arousal, physiological arousal, calming, quieting the mind, focusing on more pleasant mental experiences. So I play golf when I can't get back to sleep, and usually 2 or 3 holes, I'm back to sleep.
One personal thought is, I was diagnosed 7.5 years ago, and I made an observation to Dr. Hussein, I was under his care at the time, although he's never shot anything at me like called radiation. And I said, you know, one of the things that I've noticed, and it's still true today, is that I no longer turn the radio on in the car. I can drive literally from Cochrane to Edmonton to Vancouver and enjoy the scenery, and I'm not missing the radio at all. So I must have stumbled onto something without knowing it in terms of mindfulness.
Yes, so I know I rushed over one of the slides, but creating a special opportunity to practice, such as being in your car. I know that one of the physicians at Tom Baker, Daniel Hang, he has a mindfulness practice, and he shared with his colleagues one day that when he gets to the cancer center, he parks the car, sits in the car for 5 or 10 minutes, and just centers himself and finds himself and calms himself and prepares himself to be fully present with his patients. And I bet you they feel the difference.
Very interesting. Listen, thank you very much for a very interesting presentation here. I think you've touched a lot of us. This is the quietest I've ever heard this group for an awful long time.
Okay, thank you very much.
And I'd like to give you this tie, which is a symbol of the Prostate Cancer Canada campaign, if you will, to increase awareness.
Thank you very much, Stuart.
And
Thank you all.